think we can get started. Hi everyone, I'm Guan and I'm the co-chair of HBSSO. So welcome to our seminar today on challenges in HIV and AIDS prevention and treatment among gay men in China. So this talk is co-sponsored by the Department of HBS and also the Center for AIDS Research. Just a kind reminder, if you have a cell phone, please turn to silent or beverage. We're recording this, so this talk will be up online afterwards. I'm very pleased to be here today and to have the chance to introduce you with our guest speaker, Yanhai Wan. For those of you who are not familiar with Yanhai Wan, he is the founder and the director of Beijing Aizhixing Institute, the first NGO in China that's focused on HIV and AIDS prevention. So the name translated into English represents love, knowledge, and action. Just as it says, during the past 19 years, Yanhai Wan and his institute have been working on HIV and AIDS related policy, legal aid and human rights, and community outreach among the most vulnerable population in China. He also organized several challenging campaigns in China, including a national compensation campaign for the victims of HIV infections caused by blood transfusion or blood products, and also a national working group for the educational rights of people with HIV, and also a China HIV and AIDS NGO network. So in honor of his work, Yanhai Wan has been awarded with numerous human rights awards, and he is also a former Fulbright Fellow and Yale University Global Fellow. Many of you may have known it is not easy to activate human rights in some parts of the world. So we really appreciate Dr. Wan can come here today and share with us about his experiences. So please join me in welcoming Yanhai Wan.
It's my great honor to talk in Johns Hopkins again. I've been to the university several times. I worked with Dr. Chris Bella, and so we had some cooperation before. So also thanks for organizing this event. So about the HIV/AIDS work in China, so probably I want to introduce the HIV/AIDS epidemic in general, and then talk about the government response to the AIDS epidemic in gay communities, and then I will also introduce our own work. So China's AIDS epidemic, there were three main models. One is AIDS epidemic among injecting drug users. That was first found in early 1990 in China, Myanmar border areas. So now it become an epidemic in many parts of China, including mostly in the northwest and northwest and northeast, southwest and northwest of China, and also in urban cities, meaning in migrating populations. There were many drug users have been infected. The second epidemic model is among people who sold blood, or people who sold blood plasma, or people who received blood transfusion or used blood products. So mostly happened in mid-1990s, but still we also know many cases, after 2000, still, now the third epidemic is HIV/AIDS epidemic among transmitted through sexual, relations, including heterosexual and homosexuals. So especially among MSM, men having sex with men, populations. Yeah. So also Chinese government, health department has done a lot of research about the AIDS epidemic among MSM. So today I will, briefly introduce the epidemic. So the government estimated that there were about 780,000 infected people in China. So that is a that is a problem. I don't know, whether that number is accurate or not. But that is these figures are from a government report. Yeah. So if we look at all the populations hit by the epidemic, so the real situation is very serious, like HIV/AIDS epidemic among injection drug users, or among people who sold blood, or people received blood or blood products, or among in gay communities. So infection rate is pretty high. Yeah. So according to government research, government report, in 2011, nationally HIV prevalence among MSM is 6.3%. So that is the national figure. So if we look at in many cities, so the infection, the HIV prevalence probably is close to 10%. In many cities in the southwest, like Chengdu, Chongqing, Kunming, Guiyang. So in 5 years ago, in 2008, HIV infection among MSM, yes, was about 20%. So in some subgroups, the infection rate could be like one third of the population HIV positive. Yeah. Just wait.
I was wondering if people in 4% of men, do they identify themselves as homosexuals, or do they only engage in men sex?
So government in government research, they recruited people, identified and find people and recruited people who are MSM. Okay, I think a majority of the MSM would identify themselves as gay men, but some people they may not. For example, like some male sex workers, they may not identify themselves as gay. Yeah. Yeah. It's a national survey. Government health department largely rely on community organizations to find research participants. So we also heard, because health department encouraging the participation, and they pay certain amount of transportation or per diem. So some poor people were also recruited for the research. Yeah. But in general, I think majority of the participants identify themselves as gay men. Yeah. Any other question? Okay. So about the government, China's response. So in early time, China denied the existence of homosexuals in China. In late 1990s, after the failure of the democratic movement in China, the Chinese propaganda department condemned homosexuality, and other health, problem like teen pregnancy, drug use, HIV/AIDS as a Western disease, as a problem of the capitalist, lifestyle. So Chinese government, denied the existence of homosexuals in China. So they also told the health officials, also told the public, HIV/AIDS will not spread in China because there was no homosexuals in China, there was no drug users in China. So that was the early response in mid-1990 and later 1990 and also early 1990. Early 90. Let me see. Okay, in the middle of 1980s and late 1980s and early 1990, government denied the existence of homosexuals and the potential, epidemic of HIV/AIDS in China. So from early 1990, government began to be involved in some HIV/AIDS work linked with MSM or gay populations. One is the World Health Organization worked with Ministry of Health for a midterm AIDS working plan. So that encouraged China to do some training on social behavior study, some training on prevention and education and counseling work, or develop anti-discrimination policies. So that is the early work. So in early 1990s, I was in that time I was working in the government health department. So I was involved in set up some AIDS counseling hotlines, some educational culture, discussion salons for gay communities in Beijing. Some sociologists, some sexologists, and some sociologists, some journalists were involved in the research of gay communities and some health work. Yeah. So in the past 10 years, Chinese government has been working. The government has scaled up the AIDS epidemic, AIDS prevention and care work among gay communities. So some project has worked on this area, like China UK project, US China CDC, US CDC China CDC project, US AID project, Global Fund project, Gates Foundation, Bill Gates Foundation project. So how to evaluate the impact of the government effort in the past 10 years? So in the past 10 years, in one hand you see that the government scaled up the efforts, spend more money, and also you see that the rapid increase of community organization. So in China, probably there are more than 1,000 community organizations working with gay communities. So how to evaluate the impact of these efforts? So China is the government system is a top-down system. So how can a top-down system respond to a vulnerable populations? Have a sensitive way to work with gay communities on HIV/AIDS issues. So that is a big problem, because in China, local health department tend to respond to the tasks of to fulfill the task from the high-level health department. They are not sensitive to the communities. They are not sensitive to the communities. And so when we look at the civil society organizations, so they largely rely on the government support. Without government policy and financial support, they cannot survive, and they cannot have a sustainable, stable working environment. So in the past 10 years, all this type of international cooperation project worked with government, gave funding to the government, and the government shared certain amount of money with civil society or community organizations. Government select NGOs, and they tend to control the funding, control NGOs. And also the funding allocated for NGO is very limited, very limited. So yeah, in the past 10 years, we see, in one hand, we see the government scaled up the efforts. In another hand, we see a very rapid increase of the epidemic. So, so that is probably, the failure is linked with the government system, the bureaucracy, the top-down system. Yeah. So you can see that funding is not transparent. The government increased the funding, and China received a lot of funding from Global Fund, Gates Foundation, and other projects. It's not transparent. Nationally, in the schools, we do not have, less AIDS education, sexuality education is not common. Most of the research are controlled by national CDC. With lack of, participation of, researchers from universities. With lack of participation of the social scientists, from mental health perspective. Most of the research are from the biomedical perspective, not from social perspective. We lack of understanding of humanities in our work. Yeah. So one serious epidemic, one serious development recent in the past 2 years is that the Chinese government developed a national comprehensive social management system. So the government security agencies begin to be involved in the management and service of people living with HIV/AIDS. 2 years ago, Communist Party Central Committee organized a national, it's a national system from top to the bottom, called Central Comprehensive Social Management Committee, which has a subgroup called a Special Population Task Force, which manages former prisoners, drug users, mental ill patients, people with HIV/AIDS, religious cult members, and other people identified as special populations. Yeah. So in the government document, people with HIV/AIDS were identified as dangerous person with HIV/AIDS. So that is the most recent development. So now you can see that in China, people with HIV/AIDS lack of basic privacy protection. So the health department shared all the personal data with Ministry of Justice and the Ministry of Public Security. So the Social Management Committee, the Special Population Task Force, is led by Ministry of Justice, participated by the Ministry of Public Security and the Ministry of Health. Yeah. So this is the so our organization has been working for 19 years. Our group was founded in late March 1994, just at this moment. We have been working to provide education, information, publish newsletters. Later on, we developed a website, use internet to spread information. So our organization has been involved in advocate to declassify homosexuality as mental illness in China. So in 1996, we launched a campaign to push Chinese Psychiatric Association to declassify homosexuality as mental illness. So we had a success in early 2001. Chinese Psychiatric Association changed its policy. So our organization also involved in to help the development of gay lesbian community organizations. Some artistic events, film festivals. So we worked with gay lesbian student organizations, organized summer camps. We also sponsored some gay lesbian magazines. So now there are two major gay magazine and lesbian magazine was originally sponsored by our organization. Yeah. In the past, from 2005, our organization we organized to we expanded our community outreach among MSM in Beijing and later on nationally. So in Beijing, we managed to work in a gay bus halls, gay clubs, gay bars, online social groups, friendship, gatherings, all type of social, community events. We organized community outreach. So as an NGO, in the past years, we have distributed how many condoms? Probably 3 million condoms with replican among MSM nationally. So as just a single NGO, we have done our best. Yeah. Let's see. So nationally, we work with with MSM community organizations in other cities, in more than 20 cities, to promote condom use. Yeah. Maybe we can. Yeah.
You've spoken a little bit about how most of the funding for civil society is coming through the government. Can you speak more about kind of tensions, perhaps between the role of your organization working within the Chinese context and with such close ties to the Chinese government?
Can you speak?
Sorry.
Okay.
Can you talk, please, about how your organization works with the Chinese government and what some of the challenges might be in working with MSM and with the work that you're doing within the Chinese?
Okay. So our relation with government is very complicated. So 20 years ago, the government banned my work in the government. So when we founded our group, later on, government were not happy with us. so I've been in the blacklist of security and propaganda for 20 years. But for a moment, government, they did like our work. Like in 2004, 2005, the health department welcomed our work. We had some cooperation. But later on, so in the civil society is a broad issues. For example, we're not only working on HIV/AIDS, related education advocacy work. We also work with hepatitis B, advocacy organization. We work with gay lesbian rights organization. We work with human rights lawyers. So some of the activists working with us are also involved in, political campaign. So it's very complicated. So for some reason, also we organized the blood victims to take legal actions to sue government. So for compensations. So in one hand, government welcomed our health work. In another hand, they may not like our advocacy legal campaign. So later on, our campaign for the blood victims were banned. So government, shortly detained me and banned our meetings for the compensations. And some of our some of the founders of the institute were involved in broad, human rights political campaign. So our organization received more political attention. So but in general, government tolerates our health work, but they may not like our work with human rights organization or with. They may not like, currently we are working with the minorities, like Uyghur minorities, to provide health and legal support for the minorities. So they may not like it. So this last month and this month, we submitted a human rights report to the United Nations Human Rights Council. So they don't like it. So for funding issues, government controls most of the funding. So some foundations, they work with us and other NGOs to support civil society development. But the political environment is very complicated because foundations may have their own agendas. Government may have, may understand foundations in a different way. So eventually, we ourselves, our organization also had a problem with foundations. Foundations cut off our funding, and the government also attacked it in our organization. So currently, we managed to work in this type of environment, in this type of work for several years. We had a very good success. So in Beijing, we reached out almost all the sex clubs, or bus halls, parks, street corners, or other social, groups, very successfully in Beijing. Yeah. Not only among MSM, we also work with drug users, with ethnic groups, with sex workers. Yeah, we had a very good success to work with sex workers in Beijing. Yeah.
Thank you so much for coming here. It's a great talk. My question would be, how the social media like Weibo and QQ have played a role in HIV prevention and its advocate and human rights advocate or marginalized populations, with your work and how you see in the future in the next few years what kind of role you see?
Okay, that's a good question, because if we look at the foundations, probably I will not be positive. Yeah, we look at the Gates Foundation project. Created lots of troubles for people with HIV/AIDS. If we look at the government, I will not be positive. And even we look at the NGOs, current NGOs, I will not be positive. A lot of NGOs are also corrupt, like the government. But so the social media created some positive development. Social media helped people from bottom up to organize, to express themselves. And also social media help connections, organizing in a way that people become less dependent on funding and the government. So that is a good development. So now people living with HIV/AIDS and NGOs are using social media in education, information, spreading, also to speak out, to speak out, and also people talking about some policies, talking about the policies. So for our organization, we have 2 years ago we had our annual meetings. Not in China. We had our annual meetings in Thailand because I cannot go back to China now. So we had our meeting in Thailand. We decided to develop a comprehensive social media strategies. So we can use social media as a platform of institution management. So we request volunteers, staff, and researchers, friends, to share information in a Weibo. So that is a way of, how I supervise our organization, our staff, volunteers in America. So this is a strategy. And also there are many experts. So there are many experts. Easy we can organize, connected with all types of medical, social experts. And also we can easily to communicate with government, in the social medias. So it's amazing. Like for example, last year, several army soldiers, army officers got infected with HIV/AIDS, and the army asked them to leave. They called us through microblog. They approached us. Can you help me? Okay. Army soldiers. For example, like government people working in prisons. Government people working in prisons, working in the special zone for people with HIV/AIDS. So in China, government in the prison system, there's a special zone or special ward or even some special prisons for people with HIV/AIDS. It's an isolated, isolation policy. People working in this special zone approached us in a microblog, communicate how to, managing HIV/AIDS, issues, public health issues in prisons. Then we can introduce them to read the best practice, document introduced by UNAIDS and other, agencies. Yeah. We also organize advocacy, like a compensation campaign, advocacy. People speak out. When government detain some activists, we advocate in the microblog for freedom. It's also good in training. Like Chinese government developed some good, policy regulations. We use the microblog, using like some, audio, video communication tools to teach about this policy, these regulations, to push the implementations. Yeah. Also, for social media, you can do research. You can reach out to the communities and do your research. Yeah. Well, I think it's that is I think if we look at the future of the AIDS prevention and the care work, so the social media is very positive. So in other aspects, I'm very negative. So yeah. Please.
Well, I appreciate your talk, and I have a question which might be a very naive one because I'm not very familiar with how health services are organized. But in the U.S., for instance, all pregnant women are tested for HIV/AIDS,
yeah.
and we've reduced the transmission from mother to child hugely. And there are effective ways in which you can intervene in that. Is there a policy or is there any public dialogue about mother-to-child transmission and how that cycle could be broken?
Okay. So Chinese government has a very strong commitment to prevent mother-infant transmission. And the top-down system could be very efficient in this type of preventive measures. So the government asked hospitals to have HIV testing for pregnant women and to give them drugs for the prevention. So, but there's some barriers. There's some barriers to which might harm the efforts. One is that China's family planning policy. China has a one-child family planning policy, and China controls women's pregnancy and laboring. Yeah. So this policy might harm the work. Okay. For example, people were identified HIV positive they might be asked to have an abortion. Or if the woman, were not married, they might be asked to have an abortion. This is a family planning policy. Another policy is the isolation treatment policy. In China, so although in 10 years ago, China modified the infectious disease law. In law, the law does not require people with HIV/AIDS to be to be isolated and treated in the infectious disease hospitals. The old law requires people with HIV/AIDS to be treated and isolated in the infectious disease hospitals. So 10 years ago, the law was modified. But still, in China, government, prefer to provide treatment in the infected hospitals. So now, when pregnant women were found HIV positive, the hospitals, government hospitals might ask them to go to the infected hospitals for labeling. That is a problem because the infected disease hospitals might be good in controlling infection, but it may not be good in the child delivery. So this is an issue. And the third issue is China has a big migrant population. So in Beijing, half of the population are migrant. The ARV, the antiretroviral treatment, the government provided free antiretroviral treatment for poor people. It's good, but it's not available for migrant. So if migrant woman, got pregnant and found HIV positive, it's so that the discrimination against migrant in HIV in AIDS treatment might such a policy. Okay. Have I answered your question? Okay. So I think this is a very important issue because if researchers can do more research about how China will implement the prevention of mother-infant transmission and how other factors influence the implementation, family planning, isolation treatment policy, discrimination against migrant and other privacy issues, privacy concern issues. Other question?
Well, thanks again for your great speech. It's been really interesting. And you mentioned a little bit about how early on in the HIV epidemic, the Chinese government said that there were no homosexuals and that it wouldn't be affecting China. Can you talk about how that has changed in the past 20 years, or if it has changed, and what, I know you mentioned that now they're in the special populations,
So that is a good question. I'm thinking about, in the past 20 years, in the beginning, China responded in a close, way. Based on the communist ideology, they responded in a close way. And for a moment, China, cooperated with outside the world and worked, whether it's effective or not effective, they tried their best to work from the public health perspective. It cooperated with all types of foundations and the government and the global fund. So, but now, Chinese government are facing a challenge, a political challenge. They're concerned about a political revolution. So then they establish a comprehensive social control system, and the people living with HIV/AIDS were also targeted. So that is, I think, I don't know how can we avoid such challenge, such a challenge, because when we look at all type of foundations, when they go to China, one objective is to promote civil society response. So that's good. But they're not just how to say, when for example, like a global fund, UNAIDS, when UNAIDS reviewed the impact of global fund, UNAIDS did not provide much scientific data about how global fund are successful or not successful in HIV/AIDS prevention and care. The UNAIDS responded that the global fund promoted the development of civil society organizations in China. So global fund is not a democracy fund. Global fund is a public health fund. So this type of perspective from outside support from a political perspective, and the government responded from political perspective also. So I think this is a challenge. How can we connect more scientific evidence to advocate a good public health strategies, and also how can we use the research and to pursue the Chinese government to continue the public health. Either it's good or not. Anyway, it's not that harmful. But from a political perspective, look at the government response. It's totally very dangerous. Yeah.
I think the SARS outbreak is as well a result of Chinese government shifting their attitude from denial to open talk about the HIV/AIDS epidemic in China. I think it's about 10 years ago. SARS, the Chinese government initially totally denied the SARS outbreak in China, but it ended up actually huge outbreak. And I think that's definitely some opportunity for the Chinese government to reassess their attitude in terms of denial and other good and helpful. And I think next year, the year after the SARS outbreak, China set up the first AIDS vaccine menu clinic, and they evaluated found it successful, and during the past 10 years, there's thousands of it clinics, in China cover using It's a good example of a sort of top-down policy, a top-down consumption in China, but of course, I think Dr. Yan also mentioned
Yes.
issues surrounding this.
Yeah, so the top-down system may be dangerous in some in the health service among the vulnerable population. Yeah. For example, if we recent in the past 2 or 3 years, government sentenced Chinese court sentenced more sex workers with HIV/AIDS to jail. Yeah.
What is your suggestion to work with China government, using your past 20 years experience?
So I thought a lot recently because, to be honest, I think I myself have a legal responsibility in the past years, because when we needed to be more health oriented and from scientific approach, we become I myself become politically romantic. I also involved in some political campaigns myself. So we used to be a very large NGOs in China working on broad issues. So probably it's time for us to find some way to seize the political tension and to develop strategies to be more focused on health issues. So whatever government will respond, we will continue from a non-political public health perspective. This is the issue. And I think government also need to think from a health scientific approach. So if we can seize the political tension, and we we spend we do more research on social workers, social behavior, mental health, to understand the humanities, understand the need of people, to serve the people. So all these are the objective of the Chinese government. So Chinese government also committed to improve people's lives, So maybe we can, probably, if government can give more money to like social scientists, psychologists, nurses, social workers, NGOs, to develop their capacities to do more work, that might help. Did I answer your question? Yeah. So otherwise it's just like if just in a political slogan, civil society development, democratic governance, human rights, probably the Chinese government will be scared. Then we have no space to develop the real work. Yeah.
Again, so and if you want to stay and discuss more questions and issues raised down the line, we'll be here for about half an hour. Thank you.
Okay, thank you.